new COVID-19 cases in South Africa are not slowing down. They continue to rise, as do the deaths, sadly. Reports suggest the level 4 lockdown will be extended by at least another 2 weeks. So let's discuss this further now with Dr. Ridhwaan Suliman. He's a researcher at the Council for Scientific and Industrial Research, the CSIR. Ridhwaan, a very good afternoon and thanks for your time. You're the person who looks at the numbers, you look at the graphs, you look at what's happening province by province. Tell us what you're seeing at the moment.
Good afternoon, Rebecca. So what we're seeing is that the number of reported infections still remains high. Nationally, we're reporting an average of 19,000 cases per day over the past week, and that's the same as what we did a week ago. So nationally, cases have leveled off, and that's driven largely by promising signs in Gauteng, where the province has seen a slowdown or even possibly past the peak of infections this past week. However, beyond Gauteng, we're still seeing a rise in infections across all other provinces, notably the neighboring provinces of Gauteng, Northwest, Mpumalanga, and a surge in Limpopo right now. But beyond that, even the three other big provinces along the coast, Western Cape, Eastern Cape, and KwaZulu-Natal, are all about 2 to 4 weeks behind Gauteng's trajectory and still reporting a rise in the number of reported infections.
So, a lot of people have been asking, despite all the information out there, is what is it that has made Gauteng the epicenter? What is it that has made us so far more vulnerable to infection than other provinces?
I think there are probably a few factors at play. One is that Gauteng, relative to the other three big provinces, was probably spared during the previous or second wave, so likely lower levels of immunity and more people susceptible to exposure, and so it was always likely to have a severe third wave. That being said, I think the Delta variant, which became dominant, is highly transmissible and spread very quickly. We know that Gauteng is the most populous and most densely populated province, so once infections started to rise, they spread very quickly. And then also, I think that large movement and mobility patterns, together with gatherings and possible cluster and super spreader outbreaks, spurred on what we started seeing in Gauteng, which just spread very rapidly through this densely populated province.
So given what you're seeing and what you're seeing happening in Gauteng, the slight turn, and it's slight, and that could change, Ridhwaan, because we're seeing all these protests that are happening, the rioting that has spread from KZN to Gauteng. Do you think that that will be a game changer, or it could change that?
It certainly is a concern, Rebecca. There's no guarantee that we'll continue to see a smooth downhill in Gauteng from here on. There's always a risk that the curve may turn again. There's a risk of further outbreaks and super spreader events. And I think we do need to be aware that even though we're seeing a slight glimmer of hope in Gauteng, the case incidence at 66 new cases per day per 100,000 people in the province is really extremely high, and the risk of infection still is high. So we do need to remain vigilant and not become complacent because there's always a risk of further outbreaks.
And on that note, we're expecting to hear from the President at some point. It has to happen before tomorrow, I would imagine. Given that, would it be advisable for us to just extend level 4? Do we need to up the ante? Do we need to go to level 5? Do we need to have different restrictions for different provinces? Gauteng may be getting the strictest at the moment.
Well, if I look at the epidemiological numbers and in particular the trends that we're seeing, it's highly unlikely that we'll see a change from the current level 4 restrictions. Even though there's some promising signs in Gauteng, the risk still remains high. And then we're seeing a rise in infections still in all of the other provinces. We know that the coastal provinces are about 2 to 3 weeks behind Gauteng's trajectory. But it's not just cases. We know that hospitalizations and deaths do lag cases. The number of hospitalizations is still increasing. The healthcare system is being stretched, and it will still increase for at least 2 weeks after cases start to decline. So we do really need to try and lessen the burden on the healthcare system. So I think at this stage, while the risk of infection still remains high and while the burden on the healthcare system still will continue to increase, I think we're probably likely to continue seeing the current level 4 restrictions in place for a while yet. I don't think that a differentiated or phased approach between provinces is feasible right now, given that all of the provinces are at high risk. Possibly in the coming weeks, if we start to see a differentiation between the trajectories of the provinces, and then maybe beyond that, when we start to see outbreaks in the different provinces, I think a proactive or differentiated approach then would be most useful.
Now, Ridhwaan, would it make more sense then, like you say, we obviously can't relax any restrictions, but to maybe take the entire country up a level, because we've had 2 weeks of level 4 already. We've seen a slight change in Gauteng. Like you say, things look likely to get worse in other provinces. So what difference has it made over the past 2 weeks? Has it actually done anything? Has it worked?
I think we're starting to see the effects of level 4 restrictions now. Remember that it takes about 10 to 14 days to start seeing any effect of an increase in restrictions, and we're now 2 weeks after the initiation of the level 4 restrictions. If you look back to the previous restrictions, level 2 in the beginning of June had no effect, both on mobility, movement patterns, as well as the epidemiological trajectory. Level 3 restrictions in mid-June had little effect, had no effect in Gauteng and little effect possibly in some other areas, but I think we're starting to see that the reduced mobility, and in particular the reduction in gatherings 2 weeks ago, is starting to see some slowdown in many of the provinces, and possibly starting to drive down the numbers that we're seeing in Gauteng. So I think at this stage we probably need to give that a bit more time. We probably not in a position, I think, if we consider the socio-economic impact, to move to a higher level of restriction. So where we're at now is probably the best we can get, and hope it will have the best effect right now.